You've got to be prepared. Do not plan in a crisis. Do not plan when you've already have a problem and you're standing at the hospital emergency room or standing in the doctor's office.
You have this like chronic illness, like type 1 diabetes that for some reason is so expensive. No one really knows why. No one knows, but for some reason it's so expensive.
Inventory your monthly costs and needs. Call the health plan navigator, talk to HR, do the math.
I was reading through some of my paperwork this year, and half the year hadn't even gone by yet. And I had already spent $600 on medications and supplies for diabetes.
You have to know the formulary. So every year when the health plans renew, you have to go online, pull up the formulary and look for your drugs and make sure that they're on there at tier 1 so they get paid for. If they're on there at tier 4, you're going to pay a whole lot more.
Stock up on your supplies as much as you can. Do that monthly order. Like I had it on automatic delivery, like under my parents' insurance, I could get automatic delivery every 3 months. I got my 3-month supply. And then, even if you don't need it, just keep it coming. And at the end of the year, if your parents' deductible is met, load up on as many supplies as you can, because the time is going to come when you can't get those on demand.
So I do have a schedule with my Omnipods and my Dexcoms being shipped out more or less at the same time, which has been really helpful. And then my insulin is more on a monthly basis along with my other prescriptions. So that gets a little bit confusing with the timing of things, but it's all about just keeping organized and knowing more or less what you have and when you're covered to get your next supplies.
I just switched to a no pump literally about a month ago, 2 months ago, and I still had to come out of pocket $1,000. I had one pump and I would get caught on tubing and it would snap, and I'm like, okay, yeah, it's over. I have done this since I was 8 and I'm 21 now. I want to see something different. Everyone's telling you all of these different prices, all these different, lingos and everything. But it was also more of a situation where, okay, I know I want better for my health right now. It's worth the sacrifice for the price of it.
When I first switched my insurances from my parents to my new insurance, what they didn't tell me was that there would be a 2-week gap of when they say you're covered October 1st, but they didn't let me know that there would be a processing gap, essentially. So I didn't have my member ID, I didn't have a group number or anything really to say I'm covered and to give the pharmacy. So that was a little stressful, and having to go to the pharmacy and then basically saying you have to pay out of pocket. But what was helpful there was that they gave me a good RX code that I could use to at least get it discounted. And then when I did get my insurance member ID and everything, all I had to do was bring that back to the pharmacy with my receipt, and they were able to refund me, which was awesome because it can get very expensive. So when I made my new appointments, I contacted them and said, hey, I do have a new insurance.
Like if you're 26 and you're going to be moving to a different state, look into what options they have. Look into their Medicaid. Most community health centers, even here in New York, will see patients if you're uninsured or have Medicaid.
I always knew that 26 was coming and that I would have to get my own health insurance. I was preparing for it, but when it actually came, it was a very overwhelming process. I think just the search and really figuring out what exactly I needed without the guesswork was pretty intense.
I mean, it's scary. It's definitely because, I'm going to be graduating in about a year and a half. I mean, yeah, it's definitely something I think I'm going to have to reach out to my parents again and be like, so how did you navigate this? And I think definitely when I get hired, whenever I do my residency or whatever, it's going to be important in my interviews to discuss, what insurance you offer your residents.
Start when you're 18, even start when you're 16. Learn what is health insurance so you will know what to do when you get out of college. You'll know how health insurance works. I know it's more stressful because at our age, no one really has to do all that, but we do. Just keep on researching and keep asking questions.